Hello everyone, today I am going to explain about the ultrasound scan. It is also called as USG or ultrasonography. It is a non-invasive procedure in which sound waves are used to produce the structure of internal organs. Various types of ultrasound scans are there, like USG abdomen. It is used to detect liver, gallbladder, pancreas, abdomen, kidneys and spleen. Whereas USG pelvis is used to detect the female and male reproductive organs like uterus, ovary and urinary system like urinary bladder. Whereas USG thyroid is used to detect the thyroid gland. In what conditions ultrasound scan is advised? In people with pregnancy to evaluate the baby growth, abdominal pain, appendicitis, cysts and tumor, kidney stones, gallbladder stones, bladder stones, fatty liver, and liver and pancreas problems, abdomen ultrascan abdomen is suggested. Whereas in USG pelvis scan is advised people with irregular periods, PCOS and endometriosis problem. How we should prepare for ultrasound scan? People who are getting USG abdomen, they should do fasting for 6 to 8 hours, and at the time of scan there should be full bladder, that is at least we should drink 4 to 6 glasses of water or coconut water. Whereas people who are getting USG pelvis done, there is no fasting is required, but at the time of scan full bladder should be there. How ultrasound scan is done? It is a simple procedure, and during this procedure patient is asked to lie on the back on a comfortable table, and depending upon the type of scan, patient is asked to wear a surgical gown or normal clothes, but during scan patient should wear a loose fitting clothes, not tight fitting clothes. And during the test a gel is applied over the skin or abdomen. Gel generally helps in smooth movement and it eliminates the air bubbles so that a clear image is acquired. And after gel application a transducer probe is passed or moved over the skin, and during this procedure doctor will give instructions such as like to hold your breath or to get relaxed so that we can get a clear image. And during this procedure ultra high frequency sound waves will travel from probe into the body, and from the body the probe collects the sound waves that bounce back and it will enter the computer so that a image is produced. The time taken for ultrasound scan is generally 15 to 30 minutes, and the cost varies with the location, approximately 800 to 1500 depending upon the type of scan. Now we are going to see how to read ultrasound abdomen scan report. In the report first we'll see liver. Liver, it is an organ which is present on the right side of abdomen. If it is normal, they mention it as normal in size. If it is increased size, they call it as hepatomegaly. And if they mention about the echo texture is nothing but the tissue pattern, how the tissue is. If there is normal echo texture, they'll say as normal. If there is increased echogenicity or coarse echogenicity, there are chances of liver problems like fatty liver, liver fibrosis, liver cirrhosis, etc. And they also mention about the focal lesions. If there any lesions are seen in the liver. If there is no lesions, no focal lesions are seen. If lesions are seen, they'll mention as focal lesions are noted. In the liver, there are certain blood vessels like intrahepatic radicals, portal veins, etc. They also mention about these blood vessels, how these blood vessels are there. If they are normal, they'll written as normal. If these blood vessels are dilated, they mention as these blood vessels are dilated. Next, coming to the gallbladder. Gallbladder, it's an organ which is also present on the upper right side of abdomen. If the gallbladder size is normal, they mention as normal. In gallbladder, we most come across a word called gallbladder stones. In medical terminology, gallbladder stones called as cholelithiasis or gallbladder calculi. And in the ultrasound scan, they appear as hyperechotic lesions or hyperechogenic densities. How the gallbladder calculi are there? If it is single, they mention it as single. If they are multiple, they will mention as multiple. And what is the size of gallbladder stones? If it is 9 or 6 mm, they will mention about the size of the gallbladder stones in the report also. If there is no stones, they will mention as no evidence of gallbladder calculi. What are gallbladder stones? If the size is how much surgery is needed? Already one video has been there. Please check the description box. I'll paste the link. Next comes the CPD. CPD means common bile duct. How the common bile duct is there? If it is normal, they'll mention as normal. If it is dilated, they'll write as dilated. And in the gallbladder, we should know about the two words: cholelithiasis, cholecystitis. Lithiasis means stones. If there is any stones in the gallbladder, in medical terminology, they call as cholelithiasis. Cystitis means inflammation. If there is any inflammation in the gallbladder, we call it condition as cholecystitis. Next comes the spleen. Spleen is an organ which is present in the upper left side of the abdomen. How the spleen is there? If it is normal, they'll mention as normal. If the spleen size is enlarged, they call this condition as splenomegaly. And how the tissue pattern of the spleen is there? If it is normal, they'll mention as normal echogenicity. If the spleen tissue is increased or decreased, they'll mention as increased or decreased echogenicity, and they'll also mention about the focal lesions. Next comes the pancreas. Pancreas, it is an organ which is present behind the stomach and in front of the spine. When it is normal in size, they'll mention it as normal. If the pancreas size is enlarged, they mention it as enlarged pancreas, and they also mention about the echo texture, how the tissue pattern of pancreas is there. If it is increased or decreased, they'll mention. And also we'll come across word called pancreatitis. Itis means inflammation. If there is any swelling or inflammation of the pancreas, we call this condition as pancreatitis. Next comes the kidneys. Kidneys are the organs which are present behind, and how the kidneys are there. If it is normal in size, they'll mention it as normal. If they are enlarged, they'll mention it as enlarged kidneys. Generally, the left kidney is bigger in size than the right kidney, and they also mention about the echo texture, how the tissue pattern of kidney is there. Next comes the kidney stones. In medical terminology, kidney stones are called as kidney calculi, renal calculi, nephrolithiasis, etc. How the kidney stones are there, how much the number, single or multiple, how the size is there, how much its kidney stones are there. And a detailed video about kidney stones has been there. Please check the description box and see it. And we also come across a terminology called nephrocalcinosis. Generally, kidney has been differentiated into two parts like renal cortex and renal medulla. If there is any deposition of calcium is present in the renal cortex and renal medulla, we call this condition as nephrocalcinosis. And also we most commonly see a word called hydronephrosis. What is hydronephrosis? Hydronephrosis is nothing but it is the swelling of kidney due to blockage of urine. Due to urine blockage, kidney swells. This condition is called as hydronephrosis. And we also see CMD, that is corticomedullary differentiation, in the ultrasound report. How the cortex and medulla is differentiated. If CMD is differentiated, we call it as normal condition. In certain kidney problems, the corticomedullary differentiation is not seen or it is absent. In that condition, we can suspect that there are some kidney problems. Next comes the urinary bladder. How urinary bladder is seen. If it is normal, they mention it as normal. If there are any stones or if there are any tumors, they will mention there. And we also come across a word called bladder diverticuli. It is nothing but it is a pouch-like structure which is seen in the urinary bladder. Next comes the uterus. How uterus is seen. If it is normal, they'll mention it is normal. If the uterus size is increased, they'll mention as bulky uterus. How the uterus position is there. Anteverted or retroverted. Generally, anteverted uterus is a normal condition. If there are any cysts or if there are any fibroids, they'll mention as uterine fibroids. And generally, if the fibroids are seen in the muscle tissue of the uterus, then they'll call it as mural fibroids. And in the ultrasound report, we also see endometrial thickness. How the thickness of endometrium is there. Endometrium is nothing but it is the lining of uterus. Next comes the ovaries. How the ovaries are seen. If there is a normal are there, normal, they'll mention it as normal. If they are enlarged, they will mention as enlarged ovaries. And is there any cysts or multiple cysts are there? If there are multiple cysts, we call this condition as polycystic ovarian disease. Whereas in the males, prostate gland is seen. How the prostate gland is there? If it is normal, they'll mention it as normal. If the prostate gland is enlarged, we call it as prostomagaly. Next, finally, the impression. How the final result or final summary is there? The final summary is mentioned in the ultrasound report. This is the main important. This is all about how to read ultrasound scan report. Hope you like the video. If you like the video, please share and subscribe our channel. Thank you.